She just had a baby. Everyone expects her to be glowing with joy, but she's crying in the bathroom, feeling like something inside her just broke. Is this normal? Is this something deeper? Hi, we answer these questions now. I'm Dr. Katia Batista, psychiatrist, and today we are talking about something that many women go through but few feel safe to speak about: postpartum mental health. From the postpartum blues to postpartum depression, and even the rare but serious postpartum psychosis. Understanding the difference can save lives literally. Let's start by understanding what happens emotionally and mentally after childbirth, and why no woman should ever feel ashamed to speak and to ask for help. Childbirth is a powerful, transformative experience, but it's not just about the baby, it's also about the mother's body, mind, and identity shifting in ways she never imagined. And sometimes those shifts bring more than just exhaustion, they bring suffering. Up to 80% of new mothers experience what is called the baby's blues. In clinical setting is known to postpartum blues. These usually start within first few days after the delivery. You might feel weepy, irritable, overwhelmed, but it's only for a short period. Symptoms tend to peak around 4 to 5 days and usually resolve within 2 weeks without treatment. The key symptoms are mood swings, crying spells, anxiety, feeling emotionally fragile, but still maintaining bonding with the baby. But when the sadness deepens, when the mother starts to feel disconnected from the baby or hopeless about the future, that's not longer the baby's blues. This is postpartum depression, and it affects about 1 in 7 mothers, and it can start weeks or even months after giving birth. Symptoms include persistent low mood, fatigue, feeling worthless or hopeless, difficulty bonding with the baby, thoughts about self-harm, and changing in appetite and sleep. It's not weakness, it's not a failure, it's a medical condition and it needs treatment. In rare cases, about 1 to 2 in 1,000 deliveries, women may develop postpartum psychosis. Symptoms may include delusion, such as believing that the baby is in danger, hallucinations, hearing voices talking to her but unheard by others, severe agitation or confusion, disorganized thinking, paranoia. It typically develops within the first 4 weeks postpartum and requires immediate medical intervention. Why does this happen? Why would a time that's meant to be filled with love and celebration bring so much psychological pain? Let's talk about the causes, the risk factors, and some common myths. There is not a single cause. Rather, it's a combination of biological, psychological, and social factors. Sudden hormonal changes after childbirth, sleep deprivation, physical recovery from delivery, life changes, and identity shift, and past psychiatric history. Some women are more vulnerable to develop postpartum depression, postpartum mental health conditions in general, especially those one with a previous history of depression, anxiety, those one with a family history of psychiatric illnesses, traumatic birth experience, those one with lack of support, financial or relationship stress. Let's clear up a few harmful myths. When people say, it's just hormones, it will go away. No. While hormones play a significant role, postpartum depression and psychosis are serious conditions that need treatment. Other myth is you love your baby, you won't feel this way. False. These conditions are not a reflection of love. You can deeply love your baby and still struggle. The last one that I would like to share, only weak mothers get depressed, is not true. It can affect anyone regardless of strength, education, or even social class. Let me share with you about Emily, a 29-year-old first-time mother. After giving birth to a healthy baby girl, things seemed fine but from outside. But Emily was falling apart. She couldn't sleep even when the baby slept. Feel detached and ashamed for not feeling joy. But what frightened her most were the intrusive thoughts. Image of dropping the baby, hearing a voice telling her to harm the baby, or imagining just the baby dying. But the thoughts wouldn't stop. She felt unsafe even around herself. Emily also had suicidal thoughts. She thought maybe both she and her baby would be better off gone. Imagine. But deep down, she knew she needed help. And that's what saved her. Emily was diagnosed with postpartum psychosis, one of the most severe psychiatric conditions related to childbirth. Thanks to urgent psychiatric care, medication, and therapy, Emily recovered. Let's talk then when it's time to seek professional help. When sickness, irritability, or anxiety don't improve after 2 weeks, when you feel disconnected from your baby, when you cannot sleep even when the baby is resting, when you have intrusive thoughts about harming yourself or your baby, when you experience delusions, hallucinations, or extreme paranoia, any thoughts of infanticide or suicide are taken like a need psychiatry attention. These are psychiatry emergencies, no signs of weakness or failure, but signs of a brain in distress that needs urgent care. And the different phases of postpartum emotional distress, from the common and temporary to the severe and dangerous one, let's talk about what can be done. Fortunately, there is help, and recovery is absolutely possible. This is a psychiatry emergency. Immediate intervention is critical to ensure the mother and the infant's safety. Treatment for postpartum mood and psychotic disorders may include medication, antidepressants, mood stabilizers, antipsychotics, depending on the condition that we diagnose is needed. Psychotherapy, mainly CBT, cognitive behavioral therapy, or IPT, interpersonal therapy. Therapy focuses on emotional regulation and addressing stressors. Support groups, talking with others going through the same experience is essential. Parenting support, peer groups, the partner and the family in the treatment improves outcomes. Hospitalization in severe cases, especially when safety is at risk. Short-term admission can be life-saving. Mother-baby units where it's available. This allows treatment without separating the mother from the baby. Treatment always is tailored to each person. Remember, recovery is possible. The earlier we intervene, the better the outcomes for both mother and the baby. Close psychiatry follow-ups is essential post-discharge. Let me give you some general recommendations. Early intervention prevents worsening of the episode and protects the mother and the infant bond. The education of families and healthcare providers to recognize warning signs is essential. Encourage open conversations about mental health without stigma is important. To anyone struggling after childbirth, you are not alone. What you feel is real and treatable. Seeking help is not a weakness, it's courage. And to partners, family, and friends, if something feels off, don't ignore it. Support and ask for help. Motherhood is a time of joy, but emotional pain, and does not make you weak, broken, or ungrateful. It makes you human. If you are experiencing emotional changes after giving birth, sadness, confusion, fear, even thoughts that scare you, please know that there is hope and there is help. You don't have to go through this alone. And always ask for help. I'm Dr. Katia Batista, psychiatrist, and on this channel, Dr. Soul Rise, I share evidence-based information in a warm human way, because understanding mental health can be the first step toward healing. Subscribe to the channel, leave a comment, share with someone who might need it, or simply comment, hi, let's share your experience. Let's start a conversation with empathy just to grow. And remember, taking care of your mental health is part of taking care of your baby and yourself. Thank you.